Hey guys, you are sitting with Sony, and I'm here just wanting to talk to you guys about hormonal imbalance. So I am 33, and I'm gonna get close up. If you guys can notice, I have pimples all over my face, and you can see scarring from where I have had pimples, and they are not there anymore. So um I had my daughter when I was 30, and since I've had my daughter, my hormones have changed a lot. After I had her, I went through a huge hormonal swing. I went through, of course, like the postpartum shedding and the things that you're used to going through when you have children. That I can say I did not go through with my son. Like, I had postpartum shedding probably a little bit, but I went natural kind of soon after I had him. So I ended up cutting all my hair off anyway, and I'm thinking maybe that's why I didn't notice it as much, the postpartum shedding, because I did the big chop and I cut all my hair off anyway. But yeah, after I had my daughter, I have had a lot of hormonal changes, and they lasted a really long time. So after I had her, I'm doing good. My hair was like great, like the best. The best has been like it grew tremendously when I was pregnant. Even after I had her, while I was still breastfeeding, like my hair grew really great. These are times when I really wish I knew how to edit and add pictures in. You know how they do it. I don't know how to do that. So, um, yeah, my hair looked really good. In about 5 months, probably 4 to 5 months after I had my daughter, I started getting the shedding. And I'm thinking, okay, this is normal. Postpartum shedding. I've heard of this before. Not really thinking about how it was with my son, or the fact that I would bake chop or nothing. I wasn't really thinking about the situation with my past pregnancy. I'm just like, okay, this is normal. I'm having postpartum shedding and I'm good. So in the midst of all that, I went through postpartum blues, which is what they call it, the baby blues. After you have a baby and you get kind of down, it's a normal thing that a lot of women go through. But speaking with my doctor, I went from just the regular baby blues to actually postpartum depression, and I was on medication for that for, I'm gonna say, about 9 months. So from about 5 months out from giving birth to 9 months after that, I was on postpartum medication, which is weird right now. I can't think of what it's called, but I'll try to think of it. But it was yeah. So I was on medication for that, and I started having tremendous amounts of shedding, like where I could be doing my hair and I'm just like, what is going on? Like, my hair is falling out, where I'm like, you know pulling my hair apart, like, do I have bald spots? Like, what is happening? So all the videos that I've posted thus far, my hair has been like this, which I am about to take it out. I have naturally curly hair, and I normally wear my hair out. I don't do twist outs or twists and things of that nature. I normally just have it out in curly fro. And I know how much my hair sheds. I know what's normal for me and things like that. So I'm like, this is not normal for me. If this is still postpartum shedding, it's lasting for a really long time, which then I start reading. So I'm reading, I'm getting the information. I'm like, most of the time, this is not lasting this long. This seems like this has been forever now, and I am still having this. My daughter, she was already 1 years old, and I'm like, this is still happening. Like, my hair is shedding like crazy, and I do not know why. Like, I went to my doctor. She's just like, it's normal. Some people, it lasts longer. I'm like reading. I'm trying to do scalp treatments. I'm trying new stuff on my hair, which I've never been one to jump from product to product to product, even going natural. I felt would work for my hair and stuck with it. I'm like buying all this crap. I'm just like, this is just the worst. Like, it really changed my mood and changed my attitude, because my hair, I'm not going to say it's a big part of my life, but it is. It's like, it's for a good a good amount of people, it's like one of the first things you notice is the way a woman's hair looks. And not that my hair looking crazy is going to change how I feel about myself, because I know I'm the bomb, but it was one of them things where I had finally let my hair grow out. And when I say finally, like I said, I've been natural. My son is about to be 9 years old, so I have been natural for 8 years. And when I let my hair grow out the first time, I was dyeing it and doing everything to it, and then I cut it, and then I let it grow out again, and then I cut it, and then I let it grow out again, and then I cut it. And I kept going through that cycle because I felt like sometimes my curls weren't the way I wanted my curls to be, which I know what my curl pattern is and what looks normal to me. And when it wasn't looking normal, like the first time I cut it was mainly because I was bleaching my hair a lot. Like I was dyeing it, I was bleaching it, I was doing everything to it. And the second time, I think it was me bleaching it and then me straightening it. I'm saying time and time again, what is that many times? But the second time, and then after the second time, I just kept it short for a while. I kept it short for like almost 2 years before I actually started letting it grow out again. And when I started letting it grow out again was basically when I found out I was pregnant. So my hair wasn't like completely short, but it wasn't, I had like a little fro going on, and then I found out I was pregnant, and I just didn't cut it anymore after that. And it grew great. Like my pregnancy, my hair grew, like I have fast growing hair, but it grew even faster, it seemed like to me. And after I had Sanaya, which is my daughter's name, it grew and it was gorgeous, and it was the longest that it had been. So that's why I think it was very hurtful for me to be going through this. Like, I don't want to put the wrong message out there, like, your hair is everything and all that, because I really don't think that. But it was a little bit more hurtful because of the fact that I had finally got it to where I wanted it to be on a natural hair standpoint that I hadn't been yet. And with it shedding the way that it was, and me like telling my best friend or telling my husband, and they're like, your hair looks fine, like you're tripping. Like everybody kept saying the same thing, because when my hair was done, when it was dry, it did look fine. It looked fine. Like if I could add a picture, I would, and you would see it looked fine. But me knowing of how much that it wasn't fine, how much thinner it was getting because of how much it was shedding, it was just like something is going on here. So in the mix, by the time my daughter turned 2, I was off of the postpartum medication, and then all of a sudden my face starts to change. By then I had cut my hair. Everything with the shedding, one thing I do not do with my natural hair is try to retain length for the I don't want to say fun of it, but for just the, like, I don't know what to call that, just for like, yeah, I have long hair. Like, if my hair is unhealthy, if it's thinning, which was the case, I could have just let it grow out and trimmed it out and whatever. But I'm not about that life, so I just cut it short again, started over, and was like, hopefully it will grow out, because at that time I still really didn't know what was going on. I knew the shedding had finally stopped and slowed down, but not stopped, but slowed down tremendously. Like it seemed like it was getting back to the norm. And I was like, I do have to consider that my hair is changing, meaning like I have a lot more gray hair now than I had when I first got pregnant with my daughter, which probably it's because I was dyeing my hair before I got pregnant. I used to dye my hair black. I used to keep it dyed black. So I guess I can't say that because I don't know how much gray hair I would have had, but like stuff like that, I was like, I have to consider that, and that might just be changing and things of that nature. So sometime, like my daughter is still 2, she'll be 3 this week, and sometime in this last year, Natural 85, which is a YouTuber, she's really popular, you guys have probably have heard of her, especially if you're a part of the natural hair community. She posted a video about being on being on medication for postpartum depression after she had her son, and the fact that it was making her hair fall out. And she figured it out and stopped taking it. And when I tell you, I watched this video and my heart dropped. I went, called my pharmacist, found out the name of the medication because I didn't remember, looked it up, and yes, it was one of the most common symptoms and complaints from women, that it was causing their hair to shed, causing their hair to fall out. And it just gave me a sigh of relief, because it really, for real, when you're going through something like that and everybody around you is like, your hair looks fine, you're fine, it's just normal, and you're like, you know that it's not normal, and you're trying to figure out what is going on. It's like, this has been like a year, and there's no way that this is normal. Like, no, and you finally figure out what it is that was causing the issue. It was just like, it was just like I could breathe again. It made me feel so much better, because not better like it helped anything, or it made my hair grow back, or it made us, anything changed. Just having an answer like that just made me feel better. So with all that, finally got past it. My hair is shorter now. It's still shorter because I actually cut it again. But after all that, since my daughter has been 2, about last summer, so the summer of 2019, or let me say the spring of 2019, I start getting pimples. And I really wasn't too concerned about it, getting pimples. People get pimples, whatever. And by the end of the summer, it was like bad. Like by like the summer progression, it went from just having a couple pimples to having like the scarring. And I'm like, okay, I'm making an appointment with the dermatologist. Like, what is going on with my face? Go to the dermatologist. He's putting me on medication, and it's not helping. Like, this is, I'm gonna say, the summertime. Yeah, so this is the summertime. So summertime, he's putting me on medications. When I the first medication he put me on, do not remember the name of it. I still have it. I still have all the medications he gave me, because none of them worked, so it wasn't like I used them up. But the first one that he gave me during the summer, it caused my face to shed, like peel really, really bad and get really, really raw. And I'm just like, I cannot put this on my face. Like, it caused my face to hurt. So I stopped using it. And then he gave me an antibiotic gel to help with the pimples so they wouldn't come. That didn't work. Nothing was changing that he gave me. I'm going to throw this in there. A couple years ago, I want to say 2015, I had a really, really bad breakout of acne just on my forehead. It was just on my forehead. The acne that I'm getting now, it's hormonal acne. I do know that now, which he told me that when I started going to the dermatologist. He was like, that's probably what it is. Anyway, the acne that I had, it was just on my forehead, and they gave me antibiotics for it then, and it cleared my face up. Like this, like it was gone. Then, of course, because the acne was gone, the scarring eventually went away. So this time I'm steady asking him, like, why can't I get back on the antibiotic? It helped me last time. Like, can you just give me the antibiotic? Like, what you have been trying is not working. Which one of the creams that he gave me, my dermatologist, which is the same office, but I seen somebody different. My dermatologist did give me that cream to go along with the pills, the antibiotic pills that I was taking, but I didn't have to I didn't really use the cream at all, because the pills worked great. Like, they worked fine. They legit clear like this. And he was just so very adamant, like, no, this is different. This is not like it was last time, which it was different. It is different. But I'm like, it works. So can we at least try it? Because what you're giving me right now is not working at all. So in the course of that, over the summer, I also went through having extremely bad periods, back pain, and a bunch of different symptoms that I had to end up going to my OBGYN for. So going to my OBGYN, I ended up having to get a ultrasound and found out that I was getting cysts, which is a normal thing. If you don't know, for women, it is a normal thing through your monthly cycle to get a cyst, but the cyst is supposed to release itself like in the course of the cycle. It's not supposed to stay. You know, you get the cyst during ovulation or right before ovulation or something, and then the cyst goes away. Like, it's a normal thing that happens. My problem is that I was getting the cysts and they were not going away. They were staying. So it was causing me to have bad back pain and cramping and things of that nature. And basically it was really nothing that she could do because they would go away in 2 to 3 months or something like that. It wasn't something where it was surgery worthy. It was just something that was causing me pain. I cannot have NSAIDs, which is things of like, which is like Motrin and Excedrin and stuff, which is something that probably would help, but I can't take things like that. So, I was just basically in pain. So finding out that and, going through that process, I found out that the acne that I was having is hormonal acne because I am extremely fertile, apparently. So, you know, of course, you're having ultrasounds and things like that. They did ultrasounds at different periods of time, and they're seeing how many eggs I have and I'm releasing and all that type of stuff. And my doctor let me know, you are just very fertile right now, which is probably why you all of a sudden have hormonal acne all over your face that you have never had before. Not to say that you've never been fertile, but maybe you're just more fertile now. I don't know. So that was really fun to hear. And my tubes are tied. I'm not having any more children. That was, you know, I have a boy and a girl, and that's good for me, great for me. I said if I have any more, it would be me adopting more children if that's the case. But I'm just like looking at my doctor like, are you serious right now? Like, are you really telling me that this is why I'm going through this? Because I'm just like super fertile and I am having all of these issues with pain and cramping and backs, and my period is heavy and all this stuff because all of a sudden I'm 30. Well, at the time I was 32 and I'm fertile Myrtle. Like, what in the world? Like, you know, I was going through it. I'm like, I just found out about my hair. I done chopped my hair off. Like, I don't have time for this, honey. Like, I was over it. So of course she's telling me the only way really to get my symptoms under control is to be on birth control. My father died when I was young. He died of a stroke, and because of that, my doctors have always been very weary of what they give me in terms of birth control. I have a history of migraines. I've never had high blood pressure or anything like that, but me just having a history of migraines, if you're a woman, you probably, you know, already know all this stuff, but your doctors will, my OPGs and my doctors have always been wary of what they give me because of that and because of my family history of with my father. So she put me on a birth control, low dose birth control, and it started working. Like, the cramping eased up with the pain that I was having with the cysts, because of course they're stopping. It started clearing my face a little bit. Then it seemed like the cramping came back, which it still was clearing my face up. Like, I wasn't getting the size and amount of acne that I was before. I was still getting acne, it just wasn't as bad. So I thought that was a win. Then all of a sudden, I like the cramping, the pain, like that was one of the bigger issues too. Like, of course my face was a huge issue because I don't like having scars all over my face and pimples and stuff, but the pain that I was having in my back was a huge issue as well. And that came back. Like, the birth control didn't take that away, so I stopped taking it. And then of course when I stopped taking it, boop, 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 acne again. And it seemed like it got worse. So of course I go back to my doctor, and she's like, look, Shelly, you have to either decide to be on it or be off of it. Of course, when you go off, all your hormones come back full blown. So it's like a blast of hormones, and everything is going to be worse than what it was. So I was like, you know what? Forget it. I'm going to get back on it and I'm going to stick to it. I'm going to do it. Da da da. This was in September. This was in October. So this was in October of 2019. I got back on the birth control and I decided to stick it out. By the time my period came on, probably was like towards the end of October, and I was on birth control until I stopped taking it the beginning of February. I stopped taking it again because my body doesn't like birth control. Prior to this, I have probably been on every birth control you can name. I decided to get my tubes tied because my body doesn't like birth control. Like, I have very bad side effects to it. They don't work. Like, I was on birth control when I got pregnant with my son, so I'm going to say that that's a major issue, that they don't work for me, for one, as far as protecting against, well, that one didn't work as far as protecting against getting pregnant. And then my body reacts to me putting them types of hormones into my body, as far as how it does with my hair, how it does with my nails, how it does with my period, how it does with a lot of different things, and I just don't like it. My grandmother, when I talked to my grandmother about it, she tells me, she was like, she had the same issue with birth control, and my mother did as well. So I'm like, it's not just me. This is something that's, this is like a generational thing. Our bodies just don't like it. Doesn't like these fake hormones, which is what birth control is. It's a fake hormone that's putting in your body, where your doctor is like, hormones don't do anything to you because it's your natural hormones. It's genetic hormones is what it is. It's imitation hormone, where if you're taking a blood test, it makes it look like it's like everything is okay, but everything is not okay because it's not actually what your body produces. So I had to learn that from reading and reading and reading and reading and reading and reading, because of course when you go to the doctor, your doctor's not telling you that. Your doctor is not telling you that this is genetic whatever. No, she's not telling you that. She's telling you that birth control is no way that could cause yeast, or can cause bacteria, or can cause your hair to fall out, or could cause anything. Like, she's not telling you any of this stuff. She's telling you that birth control is fine and does not have any side effects. At least my OBGYN did. Like, she was just basically like, no, you're tripping, it cannot cause that. Then it's like you start reading different things and it's like, okay, it does cause that. You're reading the little package that comes with the birth control and you're like, hold on now, because these symptoms are on this package. Then you're reading like the boards. They have medical boards, like medical sites, where if you like Google something where a lot of people are on like one topic, or on like talk about one drug, they have a lot of those for a lot of drugs that I've encountered. Because if I'm put on a different medication, I research the medication thoroughly before I start taking it. And they have these for most of the ones that I have looked up and checked on. I also look at different sites. I always check what comes with the medication, but then I always check at least 2 to 3 other sites about the medication, because what comes with the medication is going to be the very best results. They do all these testing and stuff, and they're going to put the best stuff on here. So I check at least 3 other sites that aren't those sites, which of course I learned after that they have sub sites and sub this and all this kind of extra stuff that I really didn't know. But I try my best to do my due diligence when it comes to prescribed medicine that I'm putting into my body, that is going to affect my mood, affect my everyday life, no matter what it is. I really try to do that. Like right now I'm taking vitamin C, and I'm taking vitamin D3 with calcium because of my knee surgery. And I've been on vitamin D3 before, and I've been on calcium before. I've never been on the combined medication, what I take now, and I've never taken vitamin C. So of course, when my doctor is telling me this is what he's going to give me after surgery, I'm Googling vitamin C. Now, I know that vitamin C is good for you. I know it's in things, it's good for you, but I've never ingested it in a pill. So I don't know how it may affect my body taking it in that form. So I look it up. So even something that I don't think is going to harm me, I'm looking it up and I'm seeing how it may affect me. I'm getting a little bit off subject. I'm sorry, but say all that. I went through a lot with the birth control, and beginning of 2020, whatever, I decided to stop taking it because it was not working. It was causing me to have other symptoms, other things going on, which was like, Shelly, you're basically just taking this medicine to help clear your face. So I had to decide, is it more important for me to keep my face clear or for everything else that was going on? And I'm like, everything else trumps me having a jacked up face. My husband doesn't care about these pimples, so I'm just gonna have to let it go, because it was really just to the point where it was just like, it was like too much. It was just too much. Yeah, I'm gonna say it like that. So in me stopping taking my birth control, of course I was preparing, like, I'm about to get the acne, it's about to start, everything's about to go. I'm like dreading it. I'm in a bad mood before the acne even started, and I'm trying to prepare myself. And I'm like, Shelly, you have to stick to this regimen, which I have a face mask. When I start sharing my videos and stuff, which I haven't done yet, I probably will do today. Actually, it's funny. But I have a face mask that I use, that I have posted a picture with it on one of my social media accounts, my Instagram account. And it is bentonite clay. It's other stuff in it, but it's bentonite clay, which if you ever want to try the face mask that I have, I will be doing a full video with the routine and the stuff that I make for my face. If you ever want to try anything that I make, I actually do make it and sell it. I've only ever done that for my friends and people who seen me use it and have used it, you know, like people who know me, but I do make it, or could make it for anybody, sell it, package, ship it, whatever the case may be. So if that's the case, if it's something you ever would want to try, hit me up in the comments, let me know, or maybe on social media probably would be easier, find my email, whatever. But yeah, so I'm like, I have to stick to a routine. I have to get used to doing this every other day, because the bentonite clay, it cleanses your skin. Like, it is like a deep clean, sucks the dirt out of your pores clean. I also bought one of the little, I don't know what that thing is called, but it like is supposed to suck the oil out of your face. I ordered one from Amazon when I decided to be off the birth control. I'm like, I have to just get everything. So it's like a little device, and it's supposed to like suck the oil out of your face, which it actually does do that. It works. It doesn't work as well as I thought it was going to work, but it does work. Like right here is one of my higher problem areas where I have a lot of whiteheads. And if I was to go like this, you know, you can clearly see the little white oily stuff in the device. So it does work. It definitely works. But it doesn't work where it's like, this is changing anything, I guess. So I do pull it out and use it sometimes. It also has what's supposed to be a massager. I haven't figured out how to use any of the other tools on that thing. Like, it's supposed to be like something that massages your skin, and something that does this and that and the third. And I keep saying I was going to find a YouTube video on it and watch it, and I haven't. But anyway, I have that. I have the mask, which is the main thing, and then I have a facial scrub that I made for the scars on my face. So if you don't know, turmeric is very good for scarring. It's supposed to be very good for scarring. I have other stuff in my facial scrub. I'm not going to give my whole recipes because, of course, I just said I sell it. But turmeric is one of the main ingredients in it, and it's just a scrub. So after I do the bentonite clay mask, which, ladies, is also it's really good to clarify your scalp with that as well. I've only used it on my hair once, maybe twice, but definitely once. I used to use it on my son's hair when he was growing his hair out. I used to use it on his hair pretty regularly, and it worked really great. But I mainly use it on my face. But the facial scrub I use after the clay mask to help with the scarring. And then, of course, you rinse all that stuff off, and then your face kind of dried out a little bit. I have been putting Ambi Fade Cream. And the only reason I have been using the Ambi Fade Cream is because I haven't figured out a natural moisturizer that helps with scars. I'm like, I know I could probably put like some turmeric and some coconut oil, or I could probably do something, but it's just like I haven't found any one thing that's like, I'm going to put this on my face and that's all I'm going to have to put on my face. But the Ambi Fade Cream, I just put a couple dots here just so my face isn't dry. You know how it is when your face is like dry, you're like, you can't move it. So that is the routine that I'm trying to do. I'm trying to do this every other day. Do the face mask, scrub after the mask, and be after that. The facial scrub, it would be great if I start using that every day. But I'm not gonna do too much too fast. Let me put it that way. So, either this week or the beginning of next week, I'm going to do a video with the routine that I'm trying to stick to. And I just want you guys to let me know what you think about the routine. If it's something that I can maybe add to it to help with the pimples and the scarring and the dark marks that I have. If you guys have any information, please share. Please let me know what you think about the routine that I'm going to be trying to stick to. Give me all the encouraging words and motivation and positive energy. Keep that negative over there. And just let me know what you guys think. Like, seriously, I'm gonna really try to stick to this, like the hormonal thing, and getting my body back to normal is really important. After having surgery, you go through a lot, like the physical therapy, the medications that you have to take, and everything is like the cleansing of your body takes a really long time after you have surgery, because you're still going through so much medication even after surgery. And I'm sorry, I have to adjust my legs, so when you see me, I'm looking down and stuff. That's normally what I'm doing. I'm sorry. So just starting with the face thing is one of the things. Talking about other ways to clarify your body. I know me, myself personally, I drink apple cider vinegar straight up. I don't mix it in my tea or anything because I'm not a mixer. I just take a little shot of that at night. I need to start doing it again. I'm looking at it. I know you guys can't see what I'm looking at, but I'm looking at it right now. It is sitting on my dresser. I wonder if I flip this, you guys can see what, no, probably not. But, so I'm looking at that right now. I have to start getting back in a routine of taking that every day because it has so many benefits to you, like so many on top of so many benefits. So when we get into the episode or the recording of me doing my routine, I'll talk a little bit more about how I am also trying to clarify the inside of my body and get the inside back to where it needs to be, on top of getting my knee back to, which my knee is going to be a long process that I am at the beginning stages of. But yeah, so I am giving you guys nothing but positive energy, and thank you so much for sitting with Sony.